We've asked for your questions on Facebook, and the overwhelming thing that people are interested in is this question of cost. This first question comes from Rob Spahitz. Who's going to pay for it? Do those in excellent health, not just good health, pay the same as those in bad health? If not, what's the differential?
Devil's in the details. Okay, it's funny because the one laugh that we got tonight during the president's speech was when he said the details need to be worked out. We don't have the details. Everybody will pay something for this when they can afford to, and there will be a decision as to when subsidies and tax credits would kick in. Will there be a differential? Most likely there will be. Again, he didn't spell that out tonight. The Senate Finance Committee proposal yesterday clearly did put differentials in, depending upon age groups, etc. But what's different is it would be guaranteed issue. It's not individually rated. It's rated as a community with some variance for age and things like that.
And on that question of what they can afford, you kind of brought that question up. That's something another viewer brought up. It's been said that people are going to have to pay what they can afford, but who decides what a family or individual can afford? That question coming from Jeffrey Corcoran there.
Great question. That's going to be some actuaries who are going to have to sit down and say, what is a reasonably acceptable amount for a family to pay for their health care? One of the numbers bandied about with the Senate finance package was at no time should a family's expense exceed 13% of their income for medical care, after which there would be a kick-in of subsidy or other program.
So who's in charge here? I mean, who is going to run this entity? Who's the czar of the healthcare system?
I think that's one of the things that's already coming up tonight from the Republican side, and that is, are we creating a whole new bureaucracy to figure all of this out, or can we use existing things that are already present in the insurance industry to make some of those decisions? Answer is we don't know yet. This is the new topic for discussion. And
another topic for discussion is this idea of pre-existing conditions, because it's something we've seen so many times out talking to folks. Fawn Caldwell writes, will this health care bill be fair to all, meaning those with illnesses and those without? Are they going to be able to get care? That seems to be something that there could be some bipartisan support on. When he talked about pre-existing conditions, we saw Republicans and Democrats stand up. Is that, at least that small thing, going to be something that we might see happen this year?
I think that that's one of the critical features that has changed tonight. We've all said we want guaranteed access to health care. Everybody agrees. We've all said that we want no pre-existing exclusions, guaranteed issue of insurance. Everybody likes that. But the trade-off is, to do that, you can't have people walk in at the last minute when they're ill. If we now have the individual mandate accepted, and the White House has said that's okay, now we have the ability to treat everybody fairly. Everybody will get coverage. And as this program ramps up, there will be no more pre-existing illness. Everybody will be in the system. Everybody would have coverage.
So is this really going to happen? I mean, what happens next? You throw out all these different terms out there, but is the American people now going to buy into it, do you think?
Well, it's not the American people first. It's going to be whether or not we can get all the Democrats together, which that's very splintered right now. Can we get the Republicans to join in? Can we find the common grounds in this proposal that we haven't seen to date? And I think there's enough to chew on here that we may find not all of it being agreed upon by any means, but we may get some critical elements together to begin the process of getting true health care financing reform that then gets us what we want, and that's access to care for everybody.
So what's going to get done this year? Because it seems like the Obama administration are in a rush because they think next year it's going to become about the election. They want to get it done now when they got the big majorities before they potentially lose those big majorities over this issue.
Correct.
So what's going to happen right now?
I think what we're going to look at now is this idea of merging individual mandate with guaranteed issue. That will probably be the focus of insurance reform. Get rid of pre-existence, cancellations, and all of that. That's a big step right there. We still have not talked tonight, and the President didn't talk about how do you stabilize Medicare and Medicaid funding. Big issue. We have two programs that are going bankrupt. That needs to be addressed. It was addressed a little bit in the Senate, but it's not really addressed tonight by the President.
Another issue that wasn't addressed in great depth is something a couple other of our viewers wrote about. Claudia Jones and Shirley Starr both asked us about the question of illegal immigrants and the ER. The President tonight said that illegal immigrants are not covered in this, but that if they keep going to the ER, that's a huge cost to all of us.
There's a lot of mixed studies. Some say that there's a lot of ER use by illegal immigrants. Some say that's really not as big a chunk as people would expect it to be. But there is certainly a lot of expenditure going on for health care for illegal immigrants in this country. Some of that will continue, and it will be funded by better paying patients now. If we get everybody insured, that can help cover some of the unfunded care. That's a divide that is not going to be crossed right now about what do you do about undocumented people using health care. Some studies have already said at least half of those people will probably be able to access under one of the plans that have been described, including what was described tonight. We have to wait and see how that plays out.
So for the average Joe out there wondering and worried about their health care, a year from today, is their health care going to be dramatically different?
I don't think so. I think what we did here tonight, and we saw yesterday with the Senate proposal, is that we're going a little bit slower. We're going to try to get something in play now. It looks like he's come up with some ideas of how to bridge for the next few years and work this out so 3 or 4 years from now we're getting into true health care finance reform. And that's probably a good thing, not to jump in whole hog right now.
And, well, we'll see what happens next. Dr. Mazur, thanks so much for being with us. We appreciate it, and thank you for sharing your views.
Thank you.
God, it's such a complicated issue, but you did a great job of making it less complicated. And thank you to all of you guys as well for sending your questions via Facebook. This debate is far from over, and we're going to continue to follow it right here in San Diego 6, including during the 11 at 11 on Channel 6 and streaming right here in just a few minutes. For now, for all of us here, I'm Elex Michaelson. Thanks for watching.